From Azul Cosmetic Surgery and Medical Spa, Dr. Patrick Flaherty wants to meet you. Here is when and where. He has some seminars coming up. The first seminar is Cool Sculpting and Liquid Facelift Seminar that is happening January 16th from 4 to 6 in Bonita Springs. And the second seminar, Cool Sculpting, is happening in Fort Myers. That's going to be January 21st from 4 to 6 p.m.
All right, from Azul Cosmetic Surgery and Medical Spa, I'm so happy to welcome back to the show this morning Dr. Patrick Flaherty, along with Britton Stein, a nurse practitioner there at the office. Good morning.
Good morning, Carly.
Glad to have you back. So we're going to talk about, this is something very interesting. Again, lots of services that you offer at your practice, but fillers and Botox, and I always kind of confuse them sometimes too. So kind of explain what we're going to talk about this morning and the difference.
Okay, well, we call this liquid facelift because these are all injectable agents, and it's the fastest growing segment of the market, about 15% a year. Because
and it's still long. I mean, this has been going on for years though, but
it has, but it's picked up popularity because there are now more fillers and more options for Botox than before.
Okay.
And so it's really grown very rapidly. So the effects we can get with this in terms of rejuvenation have really expanded. And so basically the way it works, the Botox products, and there's now several of those on the market, weaken muscles. So those have been around a while, and they can take away frown lines, forehead creases, crow's feet around the eyes. So they really can take away wrinkles, which is great.
Okay, and so that relaxes the muscle, essentially.
Relaxes
That's the main
muscle.
thing it's doing.
And those are very tiny injections with very, very tiny needles, so minimal discomfort and quick results.
Okay.
And then the fillers are really complementary to that. What they do is fill in hollows or lines or creases, or nowadays we use it just to put volume back in the face, lift the cheeks, fill in the temples, dark circles under the eyes, add volume to the lips, frown lines, erase those. So the two together is incredibly powerful in what you can accomplish.
Well, and Britton, you're seeing this as well because you're working with a lot of these patients and doing the injections. What's the reaction like? What's the...
Well, it's really quite nice because you can just come in for an office visit, have the injectables done, leave that day, and it's a really powerful transformation. People leave and they have volume added to their face, and then...
So it's an immediate, really...
The fillers are immediate, yes. And then over the course of, 7 days, if you've gotten Botox, it starts to kick in, and some of those, creases that you have start to diminish, and it looks really nice.
Well, let's look at some before and afters, because I think those always speak the loudest, and these are pretty good. And again, I guess, what are some common areas? I mean, this is lips right here.
Yeah, this is lips, and a lot of people are afraid of lips because they see people have overdone lips. But if you do them in the right way and naturally and keep it within the natural contours of that patient's lip, like these, you can see it gives them a nice enhancement to the lips, which will last a year. And that's fabulous.
So what did you do with it? Is this the...
So this is Juvederm placed inside the vermilion of the lip just to reestablish some volume.
Or
that's a filler.
Okay, filler.
Yeah, so this is just filler to add volume back.
Okay.
And,
and then another before and after picture that we have as well. There we go. So the eyes.
Yeah, so this is a very popular area because dark circles, we all get them starting at about age 30, and they get worse.
We do.
So, and it's real easy to inject. When I say easy, there's minimal discomfort to the patient because it's such a thin-skinned area. We can numb it very effectively. And the fillers there can be permanent, which is really great. So you can erase dark circles for a minimum of several years and sometimes permanently.
Wow.
So
well,
that's
the
great.
eyes are so obvious, I think, when people, it really changes your appearance, and a lot of times people say you look, angry or something, before you have something done.
Right. So this is the most popular area for Botox. You can see she has the frown line between her brows, and when you put a little Botox in there, it weakens that. It'll lift the brow. You can see how the brow is lifted, and also just softens her appearance, takes away that frown or stern look, which, really it looks much nicer.
That's what I'm saying. I mean, I think that people, they get that a lot, and that's, I'd imagine that's why they come in to see you. Like, people say I always look angry, or, whatever the case may be. But again, go back to, these are really done together, which I think is key. We've talked about before, you can do Botox and the fillers together.
Yeah, sometimes people will do one or the other or both, but they're all in-office procedures, just done with a little bit of local anesthesia, or not local, but topical anesthesia. And Britton has been with our practice for a year now and is really busy with this. She's very skilled. She's a nurse practitioner and trained specifically to do these injectables. And
you were saying the downtime, I mean, sometimes you might get a little tiny bruising. That's probably the worst of it.
Bruising and swelling, you know, can be expected after fillers, but we do tell you to ice after the procedure. You know, I would say to come in, you know, a couple weeks before an event, you know, to have them done. But yeah, usually
and what
people
about
have minimal.
Pain-wise? I know, you know, you say injections or something, people get a little nervous, but it's not, you know, it's not that bad.
Well, the injectables do have lidocaine in them. But we also do the numbing cream, and we also ice during the procedure. So most people are very comfortable, and you know, I've never had anyone walk out. So.
Right. Well, and like we said, they're so popular now. So obviously they're working. People, you know, are really liking the results, and it's worth it.
Yes, absolutely.
So, well, thank you guys for being here this morning. Of course, if you have any questions for Dr. Flaherty, all you have to do is send us an email at feedback@fox4morningbblend.com.
And now through the month of January, $100 off Botox products. Dr. Flaherty would like to extend that special offer, and fillers with Britton now through the end of the year. All right, thank you so much for being with us, everyone. I'd like to thank all of our guests for joining us today. And